So that image has always stayed with me, and I still use that to describe to my patients now.
Yeah. Can you explain a little bit? Because even when you talked about your wife's tooth extraction, maybe some
Yes.
of our listeners may not understand what was the implications there. So
So our ancestors had 32 teeth in their mouth with a nice wide dental arch. We call that the cage in Felix's book. That's the cage of the mouth. And then the tongue, or is the tiger, what lives inside that cage. If you stick your tongue out and you look at it, it looks round, right? It looks, U-shaped. So that theory and the myofunctional theory and all of the breathing practices when the tongue's in the roof of the mouth, of course, for optimal nasal breathing, we have that shape of the tongue around the teeth. And it's more notable when we're younger, because we're growing, we're developing, we can see the changes quickly when we start to change those practices. But as an adult, your cage of the mouth dictates where your tongue position is. So let's say this is the spine, this is the tongue. Like we want our tongue to be up here. So when you're sleeping, the soft palate is almost supporting it and it's lightly suctioned to the roof of the mouth. But what I have noticed is that if the cage of the mouth is smaller, so the shape of the teeth, the lack of teeth when someone's lost a lot of teeth, the smaller that cage gets, the more posterior that tongue gets, the more it bulges back into the airway, and the less likely it is to be able to fit in the roof of the mouth and be suctioned there gently. So that means at nighttime that tongue is constantly falling back, so that patient is thrusting their tongue, like you said earlier, tongue scalloping is one of the signs that we look for. Because if someone's totally pushing their tongue out of their airway and their teeth are in the way, they get the imprints of the teeth onto the tongue. Most men grind their teeth, most women clench their teeth. It's just something I've noticed in my clinical practice.